Good day, everyone. So today I'm going to talk about the role of physical therapy in low back pain. So in this video, I'm going to talk about some details about low back pain, its anatomy, some examinations made by physical therapists to differentially diagnose low back pain from another or other types of diseases, and we also have PT managements and exercises made for low back pain. So low back pain is defined in various ways. So according to the European Guidelines for Prevention of Low Back Pain, LBP is defined as pain and discomfort that is located below the margin of our ribs and above our buttocks. Another definition by S. Kincade is that low back pain is a pain that occurs at the back, below the margin of the ribs and upper part of thighs. And lastly, low back pain is not attributed to recognizable or known specific pathology. So it occurs, or in other words, it occurs with no known cause. Low back pain is usually categorized in 3 subtypes. There is an acute, subacute, and chronic low back pain. So this subdivision is based on the duration of the back pain. So in this illustration, it shows an acute low back pain. It is an episode of low back pain for less than 6 weeks. In this next illustration, it shows a subacute low back pain, which usually occurs between 6 and 12 weeks. And lastly is the chronic low back pain, which occurs for 12 weeks or more. So low back pain that has been present for longer than 3 months is considered chronic. So more than 80% of all healthcare costs can be attributed to chronic LBP. So nearly a third of people seeking treatment for low back pain will have persistent moderate pain for 1 year after an acute episode. So in this animation, it shows our lower back. So our lower back comprises the lumbar spine, which is formed by vertebral bones, intervertebral discs, nerves, muscles, and ligaments, and also blood vessels. So the spinal cord ends at the top of the lumbar spine, and the remaining nerve roots, which is called the cauda equina, descends down the remainder of the spinal canal. So our lumbar spine is sturdy and resilient. So it is subject to a high degree of stress and loads, which would lead to some various problems resulting in low back pain. In the top portion, you can see the lower back muscles. So first are the muscles that allows us to bend forward, which are the rectus abdominis, internal oblique, and external obliques. We also have the muscles for bending towards the back, which are the erector spinae and multifidus muscle groups. So all these muscles work together like a team to stabilize our spine and also to create a synchronous movement in our trunk. So at the lower portion, we could see the nerves passing through the lumbar area of the spine, which illustrates a concurrent inflammation in this area, which leads to low back pain. So in this animation, we could see a physical therapist examining a patient where there is motion done on the lumbar area. So this examination or this test on the lumbar area is just one of the many tests that physical therapists do to diagnose patients presenting with back pain. So the first aim of the physiotherapy examination with these patients is to classify them according to the diagnostic triage recommended in international back pain guidelines. So serious conditions such as fracture, cancer, infection, and ankylosing spondylitis would be possible cause of this low back pain, and some specific causes of back pain with neurological deficits such as radiculopathy and caudal equina syndrome, which are also rare. And there are also non-specific low back pain, which back pain occurs with no known cause, which occurs in 90% of patients presenting with primary care with low back pain. So these are the common PT managements or physical therapy managements done to patients with low back pain. So first is the hot packs, which is applied to the back portion of the patient, most specifically on the lower part of the back. And these the rationale for hot packs is that it relaxes the tight muscles and tissues that could be causing the pain in these areas, and also it decreases pain as well, and thus increase also circulation. The second most common PT management or modality used for low back pain is also the transcutaneous electrical nerve stimulation, or which also known as TENS. So when this machine is switched on, small electrical impulses are delivered to the affected area of our body, which the patient can feel as a tingling sensation. So the electrical impulses can reduce the pain signals going to the spinal cord and brain, which may help relieve pain and relax muscles, which is explained by the illustration at the bottom part of the slide. So the next one is the ultrasound. So this is another modality used for low back pain. This is also common modality used in physical therapy. So when you hear the word ultrasound, you may think of it as an application during pregnancy as a tool that can generate images of the womb, but this is a type of ultrasound that is giving off a therapeutic intervention. So therapeutic ultrasound is often used for treating chronic pain and promoting tissue healing. So this deep heating or this modality gives off a deep heating intervention on the on any tissues that where it is applied on, and it increases blood circulation to those tissues, and this theoretically promote healing and decrease pain, which is very beneficial for patients with low back pain. So on these next slides, we could see the stretching exercises for low back pain. So weak back and abdominal muscles can cause or worsen low back pain. That's why stretching and strengthening of the back and abdominal muscles are very essential, not only for treating low back pain, but also for helping to prevent recurrence of the problem. So these are just some animations that could be seen during PT management or PT sessions for low back pain patients. And then these are the exercises: the pelvic tilt, knee to chest, double knee to chest, bridge, partial curl, dead bag, cat-cow stretch, quadruple arm leg raises. And these are just some of the many exercises for patients with low back pain.